Let's talk about something you almost definitely have in your kitchen right now, iodine. But we're not going to talk about seasoning your food. We're going to dive into its incredibly surprising new role in the fight against cancer.
Yeah, exactly. When someone says iodine, your brain probably jumps straight to iodized salt or maybe thyroid health. And you're not wrong. It's absolutely fundamental for that stuff, a cornerstone of our health we've known about for decades. It's simple, it's essential.
But what if that's just scratching the surface? What if this common, everyday element has a secret life we're only just now discovering? Well, some really groundbreaking research is pointing to a powerful and frankly pretty shocking new role for it in one of medicine's biggest challenges.
And that brings us to some truly remarkable work, coming from a research team in Mexico. They started looking into a very specific kind of iodine and its potential to completely change the game for breast cancer treatment.
Okay, and this is a really crucial point. We are not talking about the iodine in your table salt. Just adding more salt to your diet isn't what this is about. The research is focused on something called molecular iodine, or I2. It's a different form of the element, and that distinction, well, it's the key to this whole story.
So the big question these researchers had was pretty straightforward. If you give patients this specific molecular iodine, along with their standard chemotherapy after surgery, could it actually help? Could it make the treatment work better and maybe stop the cancer from coming back?
And the answer they found in their pilot study was a huge, resounding yes. The results weren't just a little bit positive, they were staggering. So let's actually dig into the numbers.
So this is the big takeaway right from the study itself. Adding molecular iodine didn't just give us small assists, it significantly boosted how well the treatment worked, and most importantly, it meant more people were living disease-free. Now, just take a look at this chart for a second. The difference is just, it's black and white. For the group that got chemo plus the iodine, 82% were free of disease progression after 5 years. For the group with just chemo, 46%. That's not just an improvement, that's a massive, massive leap.
And it gets even more dramatic when you look at the cellular level. There's this thing called pathologic complete response, which is just a fancy way of saying there was 0 detectable cancer cells left after treatment. Well, the rate for that, it literally doubled in the group getting iodine. Doubled. It's a clear sign the treatment was just hitting so much harder.
But you know, this wasn't just about killing cancer cells more effectively. It was also about the people going through the treatment. Their quality of life got better. The study found a clear drop in some of the most brutal side effects of chemo. We're talking less nerve damage, less diarrhea, and fewer cases of neutropenia, which is a really dangerous dip in your immune cells. For anyone who's been through chemo or knows someone who has, you know what a huge deal that is.
So, okay, the results are incredible, but the billion-dollar question is how? How on earth is a simple element doing all of this? Well, the proposed answer is fascinating, and it all comes down to retuning our body's own immune system. All right, let's simplify this a bit. Think of your immune system as having 2 main settings. You've got attack mode, which scientists call Th1. This is the part that aggressively goes after the bad guys, viruses, bacteria, and yep, cancer cells. Then you have calm down mode, or Th2. It deals with things like allergies. Here's the catch. Cancer is clever. It can actually hijack that calm down mode to create a sort of shield, telling the attack mode to just back off.
And that's where the iodine comes in. What the science suggests is that molecular iodine basically flips the script. It cranks up the dial on the attack mode so your immune system can go after the cancer full force. At the same time, it turns down the calm down mode that the cancer was using to hide. It's essentially taking the brakes off your body's own cancer-fighting engine.
So this is amazing for treatment, but where do we go from here? The implications are actually way bigger than just this one use. It opens up this whole world of questions about, well, could this help with prevention? And could this same idea work for other kinds of cancer too?
This table really lays it out. You've got 2 different angles here. First, there's prevention. One study looked at high-risk women, those with the BRCA1 gene, and found that the ones with the most iodine in their systems had a 50% lower risk of getting breast cancer. That's huge. And then, on the other side, you've got the treatment approach we've been talking about, using that 5 mg molecular iodine solution to supercharge chemotherapy.
And this is where my mind just starts racing. That whole attack mode versus calm down mode imbalance. That's not just a breast cancer problem. We see that same dynamic in a whole bunch of other cancers. We're talking prostate, ovarian, lung cancer, the list goes on. So what was learned here could, in theory, be a key that unlocks better treatments for so many other people.
Okay, now I have to be extremely clear about this, and it's the most important thing I'll say. What we're talking about here is fascinating emerging science. It is not medical advice. Please, do not make any changes to your health plan based on this. Any and all decisions about cancer treatment must be made with your oncologist. The whole point of this is to share information so you can have smarter, more informed conversations with your doctor.
And so that's the powerful question we're left with, isn't it? Could this simple element, something that's been on our shelves for over a century, really hold a key to unleashing our own immune system's power against cancer? It's just an incredible reminder that sometimes the biggest breakthroughs are hidden in plain sight.